Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and today we have Randall that's going to help us out with a video that we're going to do a follow-up examination on an automobile accident injury that he has sustained in his cervical, thoracic, lumbar spine, and pelvis. So we're going to see how he's doing at this point in time in his care. So Randall, let's take a look at your posture first.
Alrighty.
Now I'm going to have you flex your head forward and backwards for me. We check posture three-dimensionally first every single time. And his posture's come way up. His head's a lot further up now. He's a little bit to the right of center, so he's got a negative SX cervical in BioPhysics terminology. And he's twisted a little bit to the right, and I think that's mostly due to his sleeping patterns. You can tell a lot about a person by looking at their posture, how they sleep, how they sit, how they stand. I get forward stuff going on too from just working as a chiropractor. Okay, Randall, that's good. So let's have you lay on your back here for just a second. We'll do a few tests here on your lumbar spine. Now, he brought his little dog in here yesterday. Every once in a while, every once in a blue moon, we'll get somebody that comes in and tells us that their dog or their cat had an accident and has been dragging their hind legs. Is there any pain in your back or leg at all?
No, just tightness.
Just the tightness in the hamstring here? Okay.
Yeah.
Better down here, though, right?
Yes.
Is there any back pain or leg pain? You want to do that?
No.
Good. So he's got a negative straight leg raise test and a negative braggart. So okay, I'm going to push down. You hold it up. Try to resist me. Hold up. There you go. Good. Good. Strengthen his psoas muscle. Now let that flop down. This is a Fabre-Patrick test. Is there any pain in your hip joint?
No.
Right here? Good. Okay. There we go. Now she's getting used to me now. What's your name again?
Baby.
Baby. We got Baby in here too. She's watching this. You can see her limping around. I'm going to probably get her limping around here in a second. Is there any back pain or shooting leg pain?
No.
There we go. Yeah. Did that hurt your back at all? I heard your ankle pop.
I heard the ankle pop, but
Yeah.
that was it.
Okay, now I'm going to push down. You'll resist. Excellent. Strength. Good. Psoas strength good on this side too. We're going to do Fabre-Patrick on the left here. Any hip pain in here?
A little bit of something
Stretching
here.
more
Yeah,
than
just stretching.
pain? Okay.
Stretching, not really pain.
Okay,
I
good.
felt it pop a little bit.
Okay, now just push against me. Good. Pull up against me. Yeah, Baby's wanting to get up to see Dad. Now turn in against me. Now turn out against me. Turn your foot out. There you go. Now push hard and pull hard. Turn in and turn out. Excellent. All those are good. I'm going to have you lift your head up for me, Randall. Is there any pain in your spine anywhere when I do that?
No.
Excellent.
They just feel
Let's sit
stretched.
you up sideways and face that wall right there for a second. Okay, now we're going to do the compression test. Is there any pain in your spine anywhere?
No.
Excellent. Now we're going to do the maximum foramina compression test on the right. Is there any pain there anywhere?
I feel a little bit
A
something.
little bit right in your lower upper back and lower neck.
Yes.
And we're going to go do the same thing on the left. How about that side?
A little bit right here.
Same thing. Okay. Now we're going to have him tilt his head to the right. Is there any pain there?
No.
This gives us range of motion, but also when I do this, it's called shoulder depressor test. Is there any pain anywhere there?
No.
Just,
Just
okay,
stretch.
stretch. Okay, now left. Get a good range of motion, lateral flexion. This is shoulder depressor test. Any pain there anywhere?
Just a stretch.
Just a stretch feel. That's good. Okay, now go forward all the way. When I do this, is there any pain?
A little bit right here.
Right there. Okay, now backwards all the way. Is there any pain when you're back there?
Mm-mm.
Okay, how about when I do this?
A little bit in that same
Is that
spot.
same spot right
Yeah.
there? Okay, good. Now, I'm going to test your deltoid on the right. I'm going to push down, hold. Excellent. And we're going to do this one, hold. Excellent. These are all specific nerve roots that I'm testing. C5 is the deltoid. This is C6, the bicep. Hold that real hard. Good. And now I'm going to do triceps, which is C7. Hold. Excellent. Same thing on the right side, or left side here. Biceps first. Good. Now triceps. Excellent. Now we get our reflex hammer out, and we're going to check his biceps reflex, which is good. Brachioradialis is good, and triceps is good. So C5, 6, and 7 is all good there in the cervical brachial plexus. See, that was good. These are graded on a 5 scale, +2 equal and active is, oh no, we don't want to keep Baby. I almost kicked Baby on the reflex there. Okay, and then we do the ankle jerk here. You can't see it from there, but just relax your ankle there. Good. Okay, good. Now let's just have you stand up and face towards me. And bend over like you're going to touch the floor. Tell me if you have any back pain or neck pain anywhere.
No.
Excellent. Now I want you just to extend backwards, but don't bend your knees. Is there any back pain there?
Just a little bit right here.
Okay. Now let's put your arms in front of you, up like this. Now I'm going to have you go back like that again. I'm going to twist you to the left and push down. Is there any back pain when I do that?
A little bit in that
Increase
same spot.
on that same side?
Yeah.
Now when we go to the right and push straight down, does that increase any back pain?
No.
Or did that pop right there though?
Yeah.
Okay. Now just tilt left. Good lateral flexion, lumbar and thoracolumbar. Good. Better to the right even. Now twist left. Tell me if there's any pain anywhere.
No.
Good, perfect. Good 90-degree range of motion there. Perfect. Good job. Okay, now just walk towards the mirror on your toes for me. This is just a toe walk. You want to check that. Now turn back around towards me and walk towards me on your heels.
Oh.
There you go. Good. Now just stand right there. And I'm going to have you squat down without using your hands and just stand back up. Tell me if you feel any pain in your spine anywhere.
No.
Excellent. Good job. Okay. So now he's good on all those. So we're going to have him come over and lie on his stomach, and I'm going to evaluate his entire spine from his feet up. And then it's going to be baby's turn.
Yeah.
And you guys have never seen me do an animal. In fact, this will be the first animal I've adjusted here in Houston. I went home to Southern Illinois a couple of years ago for my uncle's funeral, and my mom's cat had hurt itself falling out of a tree chasing a squirrel. And watch your foot, baby, I don't step on you. There we go. There we go. So I adjusted my mom's cat's sacroiliac joint, and then I did a manual spinal decompression on my mom's cat by pulling its tail straight out, decompressing that spine in the lower part. But once it got done meowing out at me, it jumped off the stove and ran around without limping at all, and has been doing good ever since. If you do have an animal that has an accident, they can hurt their spines, and they have nervous systems just like we do as humans, so they can have misalignments that are pinching nerves as well as humans. But please don't be calling me with a slew of animal requests, because we really don't do animals, and there's really no health insurance for animal treatments. There we go. I'm doing this as a favor to my Christian brother Randall here. There we go. There. You got one more on your sacrum here. Perfect. Now, see, his legs are exactly even, and I bet you there's no pain at all there.
None.
Excellent. So now, see, he's already had the turbinator several times, and his tissues are now pretty symmetrical from side to side and front to back. So we're just going to increase the circulation in his paraspinal musculature by putting some deep vibration into the tissues, which increases oxygen and nutrition into the cells. But it also helps the cells carry out the metabolic waste products through just normal everyday cellular metabolism in the muscles. Besides that, it feels good, huh, Randall?
Yeah, I know.
You notice we get the pelvic muscles, and then get on the lateral thighs to get the tensor fasciolata muscles, or what a lot of people call the IT band. And then we get all the way down into the gastrocnemius and soleus, which is the calf muscles, and the hamstring. There's 4 different muscles that make up the hamstrings, medial to lateral. And then we get on his right tensor fasciolata all the way from its origin to insertion. Perfect. Yes, sir. Good job. Okay. Sure we're staying even, which we are. Okay. I think baby's getting ready for her treatment now. She's getting anxious. Okay. And there we go. Perfect. Man, it didn't get any better than that.
Yeah.
See, Randall relaxes really good. He breathes properly. That all helps. So the final thing that I'm going to do with him today is he's got a little lateral plane in his knees. So we adjust his knees up to his low back. Did you feel that all the way up?
Yes, it did.
All right. And we do the same thing on this left side. There, that was
That was a
good.
good one.
You got your knee and your pelvis on that one. Now let me help you up sideways toward your knee. There you go.
All right.
Okay, let's have you look straight ahead here while I do this. And we always adjust the extremities because they're an extension of the spine and the nervous system, so we want to make sure that the nerve tracts are completely flowing freely from the cervical spine, through the shoulders, all the way down through the arms and elbows, through the carpal tunnel into the fingers. There. Excellent movement. You should be able to hear those on the video even. Good. Left elbow adjustment there. And there's his left wrist. Okay. Very good. Okay, man, let's come back over here in front of the mirror.
All right.
Now, last thing we're going to do, like we do every time, is we're going to adjust the atlas with this specific adjusting instrument on the x-axis. Now we're going to have him do the same thing, flex forward and backwards. He's got a great range of motion. Posture's improved already.
Mm-hmm.
So we'll just have him continue to do his normal exercise, which he's been doing at home, by the way. Let me have him chin. There you go. Let me just let it go. There we go. Yep. A little tap on his atlas on the right there. And the left right there. And we're going to get his traps. And that's perfect. Now try that one more time. Did that feel smoother?
Yes.
Perfect range of motion. That's perfect posture. See how his shoulders are squared off, hands at the side. Even. Very good. Randall, would you mind telling our YouTube viewers how you've progressed with your automobile accident injuries?
I've gotten much better. When I first came in here, I had a lot of headaches, a lot of neck pain, and upper back pain, and I've seen a vast improvement. And I've been to a lot of chiropractors in my life, and Dr. Johnson's the best.
Oh, thank you.
Honestly, I mean that a lot. He's very, very knowledgeable.
Thank you very much. We
Highly
appreciate you
recommend
doing that, Randall. I know you do. He's written some reviews on us, too, on Google and Yelp, so you can read those. And next, we're going to adjust baby. But for right now, this is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.